Good afternoon, everyone, and thank you for joining us on this first Monday of spring. Hopefully everyone was able to get out and enjoy the great weather over the weekend and for the rest of the week, it seems like. So good for our health, and hopefully we'll do that in public health and safety measures by distancing and masking and all the things that we've been asking you to do. I want to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. And I'm going to start by sharing my gratitude and appreciation to the teams who helped with the setup and launch of the first Ontario Centre mass vaccination clinic that opened this morning. This clinic plays an important role in our fight against COVID-19. We know Hamiltonians are eager to get vaccinated, and we are ready. So within the constraints of vaccine supply, our teams continue to make great progress in vaccinating residents per the provincial rollout plan. However, I'm pleased to share that over 10% of Hamilton residents have initiated or completed their COVID-19 vaccine series. Thank you again to our vaccination teams, and you're all doing an amazing job. And before I hand it off to Paul, I want to once again be clear that we are still in a crisis. COVID-19 is very active in our Hamilton, in our city, and our increasing case numbers speak to that. We must also continue to follow the public health and safety measures to keep everyone safe. The virus variants are in our community. They spread faster, can bring additional health complications to those who contract them. So please think of others, stay at home as much as possible, and help contain the spread of this virus. I know it's hard to continue following these measures, especially now with the vaccine is around the corner and the warmer weather is upon us. But your efforts are going to be rewarded. We are almost there, so please continue to be patient and continue to do your part. And we will ensure that everyone that wants a vaccine will get a vaccine, not all at the same time, but as supply arrives and as the provincial protocols roll out. So please be patient, and please stay with the public health measures that are going to be very important, whether you've been vaccinated or not. I'll now pass it over to our Emergency Operations Center Director, Paul Johnson. Paul?
Thanks very much, Mr. Mayor. As everybody is probably aware by now, on Friday, the province made some additional changes to some of the color categories for the restricted areas in public health areas. And the city of Hamilton is currently in the red control category. And as a result, some changes were made to the levels of patrons that can dine indoors at restaurants. The new capacity limits for restaurants are the lesser of about 50% of the indoor dining area or 50 people. So large restaurants that could conceivably have more than 50 people, even if that was the 50% of their capacity, are still capped at 50 persons overall. There have been some questions that have been raised about changes around outdoors, and in terms of the red category, there really aren't changes to that for us. There were in some other jurisdictions around the province, but in terms of those in the red category, it is about the distancing that occurs between tables and between people on patios that dictates the amount of persons that are allowed on there, and it's you got to keep that 2 meter maintained. But the big change is the number of people that are allowed indoors. I think it's important to note that there were a couple of other minor tweaks to it, but this doesn't change a lot of the other things that we need to do if you do choose to go to restaurants. And so I wanted to reiterate those today. So with the changes, it's important to note that tables will be tables of 4 indoors, and they must be, the diners must be with members of their same household. There are limited exceptions for caregivers and people who live alone. To be exclusively with one other group, but by and large, for most people who may be planning to go out, this is not a time to gather together with friends and want to sit together at the table. If you're going out, it is with members of your own family. There will be separation between the tables. As I mentioned, that's why the number of people in the restaurant may not be 50. It may be less than that given the space constraints or the 50% indoor dining area that is already in place. But also to remind patrons and to remind those business owners alone that all the other restrictions remain in place. You're to remain seated at all times, except if you need to get up to pay or go to the washroom, of course, or as you're getting in and out of the restaurant. But this is not a chance to mill about. So if you do see people that you know and you want to go over and say hello at other tables, that's not something that is to happen. You must wear a face covering or a mask, except when you're eating or drinking. And so those are to be remaining on at most of the time, except obviously if you're having your meal or taking a drink. You will be required as patrons, and restaurants are required to take name and contact information that assists public health. Should contact tracing be required, and you will have to answer some screening questions around. Also not allowed are things like buffets, any dancing or singing or live performances at this time. And there still are the time constraints that are put in place in the red control category. Establishments are to close by 10 p.m. Alcohol cannot be sold after 9 p.m. and no one can drink alcohol after 10 p.m. I wanted to go through those because I think sometimes people feel as things are loosened and restrictions are loosened that everything is starting to get loosened, or maybe some of those other restrictions are not in place, and nothing could be further from the truth. And that also includes when you line up for things. If you are lining up and waiting to get access into a location, you need to remain 2 meters apart, wear a mask. So those pieces need to be enforced as well. So good news, I know, over the weekend for restaurants, many scrambled to get ready for that. It was an announcement that was a bit of a surprise later on Friday, but I know that many restaurants, I'm sure, changed their approach to it. I'll also let the public know that when you arrive, you should see a sign on the entrance, just like you do with retail establishments, that does indicate the total number of people that are allowed in the restaurant facility. From an enforcement perspective, this weekend started to tip us into other types of enforcement. There were an awful lot of charges issued at parks this past weekend, not having to do with COVID-19 and not having to do with those bylaws, but just entering areas that are posted as prohibited. And of course, we're getting into that nice weather. We had a bit of a blast of it. I know it'll be up and down over the next couple of weeks, given the seasonal temperatures now, but we can certainly feel the warmth of the sun, the heading towards those springtime temperatures, and many people want to get outside. And that on the face of it is very, very good. But a reminder that this is not an opportunity to go wherever you want and do whatever you want within our parks and trail systems. Areas that are marked as prohibited are marked that way for a reason. So stay to where you can walk and stay to where you can recreate. Try and keep distance as much as possible. If you don't feel you can, busy trails and things like that, wear a mask outside as well. It'll help protect everybody as you're enjoying some of this great weather. And that is it's really good news, because the more we can be outside, the better. It's a lower risk activity for sure. And there are easy ways we can protect ourselves outside, which sometimes get a little more challenging in the indoor activities. So we're really looking forward to more outdoor activities. And I can tell you from a planning perspective, our recreation division is looking at ways that we can encourage all sorts of outdoor activity as we head into the later part of the spring and into the summer, because we know that that is a great way to get the exercise we need. Quite a number of COVID-related charges on the website this week, including a number of establishments, restaurants, as well as a recreation establishment that failed to comply with a variety of things. And that included serving liquor beyond permitted times and things, which is why I went over the time constraints. As I say, some things have been relaxed, but other things remain in place. Not having contact tracing, which is so critically important these days, if there are outbreaks or there are contacts that are traced through public health. And we continue to see non-compliance with things like face covering and screening as people go into some of these establishments. So again, our enforcement is not stopping. And as I mentioned at the beginning part of the enforcement discussion, heading into some areas that are non-COVID related too. So be safe when you're outside in general, and try not to run afoul of our bylaws just in your general activities outdoors. And then as always, be as safe as you can related to COVID-19. With that, I'll pass things over to Dr. Richardson.
Thanks very much, Paul. And I, just to add to your points about the enforcement piece, as we go forward, and we're going to talk about case rates, and they are going up, and continuing to follow all of the measures that have been put in place under our local bylaws related to COVID-19, under the Provincial Reopening Ontario Act, including the changes that were made over the weekend. They remain absolutely critical in terms of keeping all of us safe as we go forward. So our colleagues in municipal law enforcement, as well as inspectors from the provincial level, continue to go out to make sure in workplaces, restaurants, retail spaces, that those rules are being followed in order to keep us all as safe as possible. So as of today, we're at 11,932 cases, up 93 cases from yesterday, with 479 screen positive cases for the variant of variants of concern, and an additional 11 that have been confirmed. And as we go forward, again, just reminding people around the variants of concern, because when it comes to so many of them, the screen is sufficient in terms of going forward. So we're not expecting to see every one of those cases confirmed, and they'll be looking at targeting some and making sure that they are identifying anything that is new that might come up. So that's the focus for those confirmed ones at this point. We do, of course, have over 90% of our cases having been resolved, and fortunately no new deaths today, which is very good. We do have 32 local outbreaks, though, continuing, and no new outbreaks today. But we do have a number happening. And for those who are able to tune into the Board of Health piece, you'll know that our outbreaks have generally been smaller in this particular wave, although we continue to have quite a number of them. Our 7-day moving average is at 88, and our weekly incidence is just over 100 per 100,000 at 102, with a weekly reproductive rate of 1.14. And of course, there's more details that you can find on our website. So as you see, we're very much in the middle of a third resurgence of COVID-19, and this is something we're all quite concerned about. We do know that we have seen this before where what happens is our hospitals become more overwhelmed, and you can see that in our hospital numbers as well. We do, whatever happens in the community happens in our healthcare system, and it happens in our schools. So you'll see a number of schools that have had cases where you'll see large numbers dismissed because we're very conservative right now around the variants of concern and trying to contain those as much as possible. And of course, we do unfortunately have a number of outbreaks in hospital that again reflect what is happening in our community. From a public health perspective as well, our ability to do all of the contact tracing is challenging because of the volume of contacts. And of course, that volume of contacts is even more than it was during the second wave because again, are being very conservative. So you'll see us again using, asking our cases to contact their contacts and make sure they're aware of what they need to do, as well as us using letters in places like schools and that sort of thing to communicate the information. So it's not overall as a community, I would say, where we want to be in terms of our case and contact, our case numbers here in Hamilton. And it is absolutely critical as we go forward. I know people are fatigued, that they're tired of the restrictions as we go forward, and we'd like to do more. This is another push through this particular resurgence as we get our vaccination numbers up, and we are getting vaccine out as soon as we are getting it. And it's vital that we continue to follow the measures as we go through this particular resurgence and as we get those vaccine numbers up. So please do stay home if you're sick. Continue to wear a mask if you're in an indoor space or if you're outdoors and unable to physically distance. Remembering too that there's lots of ways, especially as the weather gets warmer, to get outside and enjoy that aspect of spring as it continues to get warmer. Do that on your own or do that with people from your household, but please again, don't be gathering with others from outside your household. On the vaccine front, as of today, we've administered 69,000 doses of vaccine, which, as the mayor said earlier, makes us having had over 10% of the adult population in Hamilton now vaccinated. As of this morning, as you know, the threshold for age in booking through the provincial online booking tool was reduced to 75 years of age and over. Our bookings had been slowing down before that, and so we are very glad to see that opening up. We did have over 3,000 spots available to people at just before 9 o'clock this morning, and now those have been booked up for this week. At least for the clinics at First Ontario Centre and St. Joe's West 5th clinics. So if you're interested in booking into the clinics, please do check back. We are working with the province to load more appointments going forward into the system, and those should be available over the next couple of days. At the same time, you'll know we do notice that every time our call center opens up, there are people, of course, calling, and they can be quite frustrated as well with the system when there aren't bookings available. but please be patient with us over the next few days. You'll see things continue to open up and people will be able to book in. There are as well more pop-up clinic sites announced just today in the lower city for those who are 75 plus and want to get vaccinated. So more information about the dates, locations, and how to book is on our website, www.hamilton.ca/vaccine booking. And these ones you do right now need to be booking into them via the hotline. So that those can be reached through 905-974-9848, option 7. The challenge, the reason why we're still booking online for those clinics is that we found that we weren't able to do that through the provincial portal. It wasn't working well from a technical perspective. And so we're in the process of changing over to a different way of booking those and using the hotline for now. And so hopefully we'll have an online solution for those developed within the next week. Just again about the pop-up clinics overall, just to remind people that they very much are meant to be mobile pop-up clinics. They're not fixed site clinics at these outlying areas. So they go out to parts of the city who don't have a large-scale vaccination clinic nearby. We don't have enough staff, we don't have enough people to hold them in all the different spots around the city, but they can move around the city in order to provide access to people. And so they do go to an area for a day or a few days, and then they move on to another area, and they will come back to areas over time. And certainly we'll be coming back as well to provide second doses when we're that further 3 or 4 months out. So please do keep looking online. We will try and get a schedule now that we understand this interrelationship with our booking tool. We'll get a schedule that extends out a little bit further in terms of our mobile clinic as well. So that's it from me today, Mr. Mayor. Back to you.
Oh, Mr. Mayor, we just have you on mute there. Let's see if does that work?
Okay, that must have been.
There we go.
I used my little button. I think you did an override there, Jasmine. Thank you. Thank you, Dr. Richardson, and thank you, Paul, and for all that information. And in addition to following our public health measures, which should continue to be followed even if you've been vaccinated, there are a number of ways you can help stop the spread. You can download the COVID Alert app on your smartphones with the App Store or Google Play. You can donate to the local food banks, including the Hamilton Food Share or Food for Kids and the Good Shepherd, just to name a few. The demand and need is still great, and the more you can share food and or dollars, they can turn that into multiples of dollars for food to help those that are needing food right now. If you're in good health, consider donating blood. Visit blood.ca to book an appointment, and continue to shop and eat local whenever possible. So visiting the hometown.ca hometownhub.ca to connect with and support our amazing business community, and continue to check on your neighbors, especially the elderly neighbors, to make sure they're getting what they need and everything is okay. There's folks out there that don't have a support network, and certainly rely on their immediate neighbors to look out for them. And so whatever you can do to ensure that they're getting what they need, that would be great. So let's continue on with our session here by going to Jasmine for some media questions. And I'm sure there's just a few. Jasmine?
Thank you, Mr. Mayor. We have 5 media joining us today. I will start with 1 question and 1 follow-up for everybody. The first question will be to Don Mitchell from CHML. So Don, you can go ahead.
Thanks, everyone, for taking my question. So I guess I'll start with Dr. Richardson and just kind of comparing rising case counts around the Golden Horseshoe right now. It appears Hamilton's actually becoming like the number 2 hotspot behind Toronto. I wonder if you could speak to that, and you kind of touched on it a little bit earlier, where you talked about smaller outbreaks versus the community. Can you kind of address that in terms of the increases that we're seeing? Is it more coming from the community? Is that what the issue is right now?
Hi, Don. Thanks for that. Yes, I would say more so from the community. When we look overall, we certainly have a number of outbreaks, so that is definitely contributing to them. But they tend to be smaller outbreaks than what we were seeing before. So it's a bit of a trade-off in those two different aspects of the outbreaks. But certainly the majority of our cases at this point are coming from the community broadly. So these are still household contacts often within the community, but they tend to be coming from there.
And my second question is just with vaccines, and I don't know if you can do this, but I might be putting you on the spot. But ballpark usage of or percentage of usage, I guess. Would you have any numbers for that? I'm going to assume AstraZeneca you don't, because that's exclusively in the pharmacies, I believe. But I mean, in the ratio of Pfizer being administered to Moderna.
Oh, you mean between the vaccines
Between
as
the two,
opposed to
is
the
Pfizer like
proportion?
90% or?
I could probably give you some quick math. We have just a small amount of AstraZeneca. That's actually in our primary care pilots here in Hamilton. So that would be less than 10%. Probably around 5% of our vaccine would be AstraZeneca right now. And then by far the majority would be the Pfizer vaccine that we're using. And then in the middle would be the Moderna product, which we have gotten, but don't get in as great a quantity as Pfizer.
Thanks, Dr. Richardson. Our next question will be to Dale from CHCH. Dale, you can go ahead.
Hi, thanks for taking my questions. Dr. Richardson, with Hamilton's 7-day rolling average at 88, and you mentioned the per 100,000 numbers, should case numbers still be the primary indicator on whether or not regions go into lockdown in your estimation with mass vaccination taking place?
Thanks very much, Dale. That is a very good question and one that we're contemplating. Just as you say, when we look at the implications of cases, there's two things that are that we're tracking most closely, and that's the severity of the disease and the death rate from the disease. So hospitalizations and death rates are very much a critical part of this. And so we have been vaccinating those that are at highest risk. We've vaccinated long-term care homes, we've vaccinated retirement homes, we've gotten through vaccinating those who are 80 plus. We've had that on offer now for some time. We're moving down to the 75 plus, and that inflection point, if you will, that point in the curve where it curves up is around about 60. And so that's why you'll see those 60 and above being in that phase 2 vaccination group. So when we're looking at what we do and where we go, yes, cases are of concern. We still see our largest number of cases coming from that 20 to 40 year age group, and less so cases in that older age group, less so outbreaks that happen in long-term care and retirement homes. You may have heard Steph Hughes, our epidemiologist today, talking about that at the Board of Health and talking about how the outbreaks in long-term care and retirement homes are quite small at this point. So definitely those are the two metrics that we're tracking most closely of all. We're also looking at the proportion of cases that are due to the variant of concern. We're behind the province on that one. We're in the low 30s. The province is up at 50%. So we're looking at that as well as we understand the variants becoming a more dominant piece of the picture here in Hamilton as well. So that's probably where our largest focus is.
Thank you. And I guess whoever wants to take the question, the first day of the First Ontario Centre in operation, or did any challenges arise from the first day of operation?
No, we have had staff working on that clinic from across the city and across public health services for several weeks now, trying to get that open and running, and they've done a very good job. And at this point, Paul, I have not seen anything in particular. We certainly would love to have even more vaccine and open up more slots as we go forward. But Paul, anything else you've seen?
Just two things. One, a reminder for the public. We did see some lineups first thing this morning, and a number of people were there well in advance of their appointment time. So it would be best if people arrive closer to their appointment time. It just stops the lineup from being long. And we understand that people want to get there. They want to get their vaccine. You don't have to worry. We're very conscious about booking so that there is vaccine. You will get the vaccine. So if people could come closer to the time of their appointment, that would be great. That was about the only hiccup this morning, as the lineup looked just a little bit longer than it should have been given the timing of the vaccines. And we're also continuing to work on parking issues around First Ontario for drop-offs, but those things, will get ironed out. And as Dr. Richardson said, a smooth start. It's a good news, bad news scenario. We don't have enough vaccine to do the 3,000 a day, but probably starting it up on the first couple of days, it's nice that we don't have 3,000 appointments a day, so that we can see how things go and continue to improve. So just one piece to remind the public is that, come in and around your appointment time. Nothing wrong with being a little early, but significantly early just adds to the lineup of people. We do check as you come in. You'll have to go through a number of steps. So it's best if we can try and stagger that out and stop people from congregating, gathering, and being in line. And today is a nice day, but if the weather's also a little inclement, we would hate to see people standing outside for a period of time as we try and get people in. So that would be the only piece of feedback I'd have.
Great, thank you, Paul. Next question will be to Desmond from CBC Hamilton. Desmond, you can go ahead.
Hi, good afternoon. Dr. Richardson, with the closure of the Dr. Davy Elementary School and the number of cases there, a teacher at the school is calling for an asymptomatic testing clinic to be set up there. What would you say to that? Is that something that you would support? Do you have the kind of resources to do that?
Thanks, Desmond. So the asymptomatic testing, by and large, is overseen by the school boards in terms of when they bring those in. And it's actually school board or Ministry of Education resources and vendors that do those clinics when they happen. So it is something we look at from the standpoint of a public health response as we go forward in terms of how best can people access testing, knowing that we want to get them tested early on and then again later on as in terms of contact. So our outbreak team will continue to talk with them about what's the best way to provide access to testing and make decisions as we go forward.
Thanks for that. And generally, it seems there's still some level of hesitancy when it comes to the AstraZeneca vaccine. What would you say to people who are still hesitant to take that vaccine?
Yeah, so AstraZeneca, that vaccine, it's, I love the line. I'm trying to remember who it was that said it, but what's the best vaccine to get? It's the one that you can get, what you're eligible for as soon as you can possibly get that. And so AstraZeneca, as we know, is available in our community through the pilot program that's being run with primary care. We might be able to get some pharmacies added that have AstraZeneca as well. And of course, given the lower age group, that does extend availability to an additional group who are more vulnerable in our community. So in terms of the vaccine itself, it is a very effective vaccine. When you look at our flu vaccines that we have, it performs very well in relationship to those, as well from the overall safety and what happened in Europe. We've now had both Health Canada and the European Medicines Agency look at those issues and say they're not concerned, and absolutely the benefits of that vaccine outweighs its risks. So very much encourage people, get the vaccine that you're eligible for as soon as you can get it.
Thanks, Dr. Richardson. Our next question is to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi there, thanks very much. I hope everyone's having a beautiful day. So I have vaccine-related questions, so most likely for Dr. Richardson. I was wondering, first of all, for going back to the question about housebound seniors, I know you previously mentioned that was a challenge that public health was kind of looking into. And I was just curious if maybe you could speak to specifically like what Hamilton Public Health would need to kind of help those seniors get their vaccines.
So in order to vaccinate this group, and I should stop for a minute and just say, Maria, I'm glad you bring up those nice sunny days, and it's lovely, and I hope you've had a great weekend too. To vaccinate this group, part of the challenge is knowing who they are, where they are, and those pieces. So we have our partners at St. Joe's who began this process with home and community care have been looking at a list, and we are continuing to work with the home and community care group from the LHIN about who these people may be. Our paramedics colleagues are working with them to identify who they might go out to, how they could go out there to vaccinate them. And then of course, there's the matter of the vaccine they can take. Ideally, what you'd have for this group is you'd have a vaccine that's very stable and is in single dose syringes, and you can take that way. That said, there are ways they're looking at taking out the other vaccines to this group. So I'm hopeful they'll get through those challenges and figure out a way to move forward with that soon.
Thank you very much, and thank you. I am having a good day. Other public health units, including Halton and Norfolk, have begun pre-registering people and or keeping wait lists of people in younger age groups to fill vaccine slots in case there are some left over, or if there's cancellations or things of that nature. So I was curious if Hamilton is considering doing the same.
Thanks, Maria. And you did cut out just at the beginning. So if I did miss a piece of your question, just let me know. But I think you were speaking to the pre-registration process and the process for using residual doses as we go forward. And so absolutely that process has been in play for us since the very first clinic that started at HHS back in December, where there's a list of individuals who can be called in on short notice in order to get the vaccine. Those have been for us concentrated in the group that we're doing at the present moment. So in our phase 1 group, it's been people who can come on short notice to come forward. So amongst our healthcare workers who might be able to come in, our paramedics, our fire, our police. And for some of those groups, that's been the principal way they've been vaccinated. It's by showing up on short notice rather than booking into slots that others could use, but coming to use those residual doses. So at this point, we don't have a means of creating an additional list, and we haven't needed an additional list in terms of using those doses. But as we go forward, we'll continue to look at all the ways we can work through the populations as we go forward.
Thanks, Dr. Richardson. Our next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions. My questions are for Dr. Richardson. Firstly, considering our current numbers, Dr. Richardson, in the presentation of health, what do you think about the loosening restrictions over the weekend, and what are you asking the province to do to get our numbers back under control?
Thanks, Joanna. I mean, that dialogue at the provincial level about what is the best way to move forward through this phase, and talking about what Dale mentioned earlier about, our primary objectives here are to reduce the likelihood of people having severe disease, to reduce the number of deaths due to COVID-19, and to make sure that our health system is not overwhelmed by the disease. Those are our two sort of North Stars in this process. So as we talk more about those and what's needed and monitor those things, looking at the framework, there's very much a balance going on between COVID-19 and the other unintended consequences of what the control measures do. So be they around employment and being able to have businesses open that can provide services to people, whether it's around mental health and those sorts of aspects, they're all really important considerations as we go forward. And so when we're looking at the differences between red and gray, there's not a lot of difference between those. The changes the province made around dining, while it did open up in terms of having more present in a space, it's still limited by spacing, which is critically important. It's also emphasized the piece about you must only be dining with those who are in your household. So that's actually an improvement in making that very clear in the red zone, that if you are dining indoors, it should only be those who are in your household again. So that's a critical piece as we go forward. You shouldn't be spending time with people from outside your household, but we also need to think about the restaurant workers who are working. I was looking at some of the media over the weekend, and you would see pieces where people were not wearing their masks as they were sitting in the restaurant or waiting, or they may be standing up. And all those other pieces of the rules about you need to be sitting, you need to be masked unless you're actively eating or drinking, not just while you're sitting there. Those are critical for all the people in the restaurant, as well as for the workers in the restaurant. We really need to do our parts. If we're going to go out and we're going to dine in those restaurants, then we need to be also doing our part to keep those workers safe and the other people who are in those restaurants safe. So those are critical. We do know, of course, there's been a large outbreak in Halton at the end of the week last week, which involved many, many contacts because those sorts of measures weren't necessarily in place. So very important that that happen.
Thanks so much. And my second question, the vaccine rollout for Indigenous adults in Hamilton has been called muddled, a mystery, a break of trust. The Hamilton Regional Indian Center and the Aboriginal Health Center were awaiting clarity, you know, when I went to them to talk to them about this rollout. You know, what do you have to say about this, considering this is supposed to have been one of the highest priority groups for vaccination for weeks now?
Thanks, Joanna. So we have been working with our Indigenous community now for months in terms of managing the vaccine rollout for this group. You'll know that there was a process with St. Joe's Hospital that had been worked out directly with the Indigenous community around beginning the vaccinations of those who are 55 plus, which was great. Started to get those people open up slots so that people could book in. We also know that that we were able to move to all Indigenous adults sooner than some communities have been able to do, and open it up across the board so that people could book in. One of the unfortunate things is there's no online way to for people to book in, and so we were very conscious of using what are called lists to load into the system, and what that might feel like. From that perspective and how acceptable that is. And so worked through with our community in terms of the hotline, what might work well for them. And so opening it up with the hotline was the thing that was decided last week. And then we'll continue to look at with that community, what is the best way to do this as we go forward. There is, of course, a clinic that is happening this week at one of the sites, which is great. And so that is actually happening at the Perkins Center at 1429 Main Street East. And they'll be holding the pop-up clinic there on March 26th from 10 to 3, March 27th from 10 to 1:30, and March 29th from 10 to 3. So weekend days and weekdays that are there for people to book into during the daytime. And they can book all of that through, again, that number 905-974-9848, option 7.
Great, thanks, Dr. Richardson. We do have a bit more time, so we'll go through for one more question for everyone. First, if you'd like another question, Dawn, you can go ahead.
Oops, sorry, I wasn't quite prepared there. Can you hear me?
Yes, we can.
Oh, okay. Because it said they keep saying that I'm muted here for some reason, but anyways, you can hear me. Yeah, I guess for Dr. Richardson, I don't know if you can answer this, but ICU levels compared right now, let's say within the city, in terms of our cases, are we seeing like a significant increase? Is it still, you know, our hospital is still jammed with a lot of people? Would you know?
So when we speak to our hospitals, we do this review with them on Wednesdays each week. And at the part of the challenge in our ICUs is they have been accepting cases from across the GTA in terms of helping to do load balancing is what it's called, but helping our colleagues in Toronto and Peel and elsewhere in terms of looking after people in the ICU. So certainly they've had some significant utilization from that standpoint. And there has been some related to local cases, but they're managing that for now. They are going to need to look at how that fits into the larger picture as we go forward, given the number of cases that we have. And then we'll be getting more updates from them in the middle of this week.
Thanks, Dr. Richardson. We'll go next to Dale from CHCH. Dale, if you'd like another question, you can go ahead.
Thank you. For Paul, you mentioned earlier that the parking issues around First Ontario Centre are being ironed out. I guess what direction or guidance has been given to bylaw officers on how to operate or give tickets out right now?
So there are areas that are designated for drop off and pick up. And so those areas, I believe all the meters are bagged so that people won't park there generally. And if people are parking there for long periods of time, they may get ticketed, but they are the drop off and pick up areas. And then there is 2 hours of validation at the York Street Parkade. So if there have been issues, I haven't heard about tickets being given out. So clearly we've worked with our parking services. And in fact, they came up with the solutions for us in terms of how to handle these. So if there have been issues today, then I'll get a handle on those and we'll try and make sure that those are improved. But it's not a situation where people can park wherever they wish. and simply come in for the vaccine. And there is a time limit to the validation. We believe 2 hours is more than enough time for people to arrive early from their appointment. Appointments are generally, as Dr. Richardson has shared, about 45 minutes would be your start to finish of getting the vaccine. And even if there were some additional pieces that had to happen around clarifying anything, that should give more than enough time with 2 hours. So if you are outside that 2 hours, there may be a ticket piece. And if you are parking in areas that aren't designated for pickup or drop off, then that could also lead to some tickets. But if there are some issues that have happened today with tickets being issued, then I'm sure I'll hear about it, and we'll continue to make it as clear as possible how people can get the free parking that they need, and also the pickup and drop off that they may require.
Great, thank you, Paul. Next question can be to Desmond from CBC Hamilton. Desmond, if you'd like another question, you can go ahead.
Yes, Dr. Richardson, could you elaborate just a bit more on the hospital numbers at this time, the hospitalizations? Is the system close to being overwhelmed?
Thanks, Desmond. So at this point, I don't think they would say they're close to being overwhelmed. I think they are needing to look at the issues with load balancing across other regions and say, you know, this isn't the time for Hamilton to be the spot where people can go, but because we need to look after people who are our own. I think there are some particular challenges when it comes to having outbreaks in the hospitals. And so as HHS deals with the outbreaks that they do have on site, that puts an extra load on their staff, an extra strain on their staff, because of course there can be contacts that happen in the staff group that decreases the number of staff that are available. So we'll watch it closely as they go forward. But at this point, I wouldn't say they're at risk of being overwhelmed, but it is something that needs to be closely managed.
Thanks, Dr. Richardson. Next question, back to Maria from the Hamilton Spectator. Maria, if you'd like another question, you can go ahead.
Thank you, Desmond. Back to you, Dr. Richardson. So with respect to the AstraZeneca vaccine, we've been getting questions about why is it that Hamilton is only having a primary care pilot and not rolling out the vaccine in pharmacies. So I was wondering if that was a request from like locally that we only have it as the primary care sort of pilot, or was that mandated by the province? And whether you would like the city to have those vaccines in pharmacies right now.
Thanks, Maria. Indeed, these are decisions that are made at a provincial level as they're looking at what vaccine is coming in and how can it best be utilized across the province. They are making decisions around how to use it. And so we were offered to do the primary care pilot, and we took them up on that offer. I should say my colleagues in primary care took them up on that offer and have been working hard through 12 of the clinic sites to get that out and rolling. So 3 of those are working together across the CHCs, but they have been actively doing that. It's really important information in order for us to understand how primary care can get further involved through their own practices to roll out the vaccine. On the pharmacy side, the pharmacies have been working directly with the province around the pharmacy rollout. They do seek some advice from local public health when they're looking at where they're going to roll that out. Again, we had a limited supply of AstraZeneca, and so they chose 350 pharmacy sites across a limited number of spots in order to roll that out and get that working, see how that was running. They do now have the promise of more AstraZeneca coming after the US government decided to look at how they could give us some more here in Canada on a loan. And so they are looking, the province is looking to double the number of pharmacies that are involved, and they're talking to places across Ontario to look at how could that happen. So we've been talking with them too. We would love to have more vaccine. We would love to have it in our pharmacies. While they get through a smaller number of people per day, there's many more pharmacies. And so it's definitely a resource that we'd all love to tap into, because that means we would have more vaccine here in Hamilton. So we continue to work with the province and work with our pharmacy colleagues on how that might happen.
Thank you, Dr. Richardson. We'll go next to Joanna from the Hamilton Spectator. If you'd like another question, Joanna, you can go ahead.
Hi, thanks for the extra question. Dr. Richardson, I'm not clear on exactly what it is that you're looking for to help get Hamilton's numbers down. Like, do you think Hamilton needs to go into a lockdown, or is red, are the restrictions in red sufficient?
So, Joanna, I think the most important thing to remember when it comes to COVID-19 is what each of us chooses to do that determines whether or not we're going to have more cases. And so what we need to do, whether we're in a lockdown or we're in a stay-at-home order or whatever it may be that's required from a legislative standpoint, or that government comes into place, it's requiring us to do the things that need to happen. So I think I'm really clear on what needs to happen. People need to stay home as much as possible. They need to not be with people from outside the members of their own household. They need to stay home if they're sick and not go to work, not go out to other places. Should be going out for essential trips only as we go forward. And those, key things that we've been talking about all along. So whether we're doing that under a stay-at-home order or we're doing that in whatever level of the framework that we're in, those are the key activities. We can do those as people. We can make those choices. Now, do we need another level in terms of people saying that that those must be done? Well, we look at these numbers because Hamilton, particularly being in the GTHA, we're very much influenced by what's going on around us as well. And so as we have conversations over the coming week with the province, we'll be saying, okay, when we're looking at at mobility that's happening and we're looking at the things that are going on, can we ask people to do that and they'll be able to do that? Or do we need something more in terms of an intervention at the provincial level? And so we'll watch the numbers and continue to have that dialogue with the province.
Thanks, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So I will pass things back to you.
Great. Thank you, Jasmine. And thank you to our broadcast team, Bill Custers at Cable 14 and Clear Cable, and to the media partners who joined us each and every week to ensure that we share important information with our broader community. And as always, for more information on COVID-19, financial supports, and any updates that you're looking for, you can visit our website. It is updated regularly. It's got the latest information on there. So it's hamilton.ca/coronavirus. That is the best source of up-to-date information that's updated as quickly as we update here or at the council or anywhere else. Our website team continues to work to ensure that accurate information is uploaded. And I like to mention at the beginning of today's briefing that the weather has been favorable and people are itching to gather with friends and family outside their household. But remember that Hamilton is still in the red control category, only one step away from a lockdown. So please continue to follow all of the public health measures. They work and they help stop the spread of this virus. We will get through this and we will be able to celebrate safely with friends and family somewhere soon down the road. So don't let our hard work over the past year go in vain. This is time to be vigilant, to stay focused on some of those measures, even if you've been vaccinated, until such time as we have a good majority of our population vaccinated. And we're not sure at this point when that's going to be, but certainly over the next several months. So stay the course, don't let up, take care of one another, and we'll see you at our next media briefing on Monday, March the 29th at 3 p.m. next Monday. See you then. Take care.